The interview is within the novel.
Good afternoon, everyone. I stand on the protocol well established by the registrar. By the registrar. However, however, I recognize my colleague, Vice Chancellor of Lagos State University of Science and Technology, Kurudu, Professor Olumiwa Otusoya. I read the citation of Professor Oladipo Adeboluji, Adeboluji Adewole, the 125th inaugural lecturer of our university. Professor Oladipo Adewole is a distinguished orthopedic surgeon, academic leader, researcher, and administrator whose professional career spans nearly 4 decades of dedicated service to medicine in Nigeria and beyond. It has contributed significantly to orthopedic surgery, medical education, and health systems development in Lagos State and the West African sub-region. He obtained his early education at King's College, Lagos, and graduated from Obafemi Awolowo University, Ile-Ife, in 1984. He is a fellow of the West African College of Surgeons and the International College of Surgeons. Professor Adewole completed residency training at the National Orthopedic Hospital and WHO Collaborating Center, Lagos, in 1995. His consultant career includes service at the Nigerian Railway Hospital, Timeta General Hospital, Lagos, and ultimately Lagos State University Teaching Hospital, ASU, where he has served since 2001. He was appointed Lecturer 1 at the Lagos State University College of Medicine in year 2004. He currently holds the positions of Professor and Head of Orthopedic Units, Department of Surgery, Faculty of Clinical Sciences, and Head of Department of Orthopedics at the Lagos State University Teaching Hospital. These roles reflect his leadership in clinical orthopedics, medical education, and institutional development. Professor Adewale is a prolific scholar with over 40 publications in peer-reviewed journals covering blood clot management, pediatric orthopedics, limb deformities, osteoporosis, spinal disorders, and orthopedic service audits. He is very passionate about the correction of clubfoot deformity in the newborn and has published several works that have shaped national understanding of clubfoot management. He is an international specialty club foods champion, and he is actively involved in the training of 130 club food treatment practitioners in Nigeria. He has also authored chapters in major surgical textbooks, further cementing his role as a leading educator in the field. During his tenure as head of Department of Orthopedics, ASU, LASU secured full accreditation for the training of postgraduate orthopedic surgeons, and to date, over 10 of his residents have been awarded the fellowships of the West African College of Surgeons and National Postgraduate Medical College. His continuing professional development includes participation in numerous international courses and symposia across Africa, Europe, the Middle East, and the Americas. His global exposure has enriched orthopedic practice in Lagos State and contributed to the modernization of trauma and deformity care. Professor Adewole has served the medical profession with distinction through numerous leadership roles. He is the current chairman, Faculty of Orthopedics, member of Court of Examiners, and member of Council of the West African College of Surgeons. He has served on the Management Committee and Medical Advisory Committee of LASU, and is currently a member of the LASUCOM Court of Governors. His national service includes membership of the Ministerial Committee on Emergency Preparedness. He is a member of several professional bodies, including Nigerian Medical Association, Nigerian Orthopedic Association, West African Orthopedic Association, International College of Surgeons, Société Internationale de Chirurgie Orthopédique et de Traumatologie, SIPOC, and the Prosthetic International Association. Professor Adewole's career reflects excellence in clinical practice, scholarship, leadership, and service. His contributions have shaped orthopedic surgery in Lagos State, advanced pediatric deformity care, and strengthened surgical training across West Africa. His inaugural lecture marks a significant milestone in a career defined by dedication, innovation, and service to humanity. Distinguished guests, ladies and gentlemen, I hereby present a curious researcher, a dedicated and insightful scholar, Professor OLADIPO ADEWOLE, to present the 125th inaugural lecture of our great Lagos State University. Professor Adewole, over to you.
Vice Chancellor, Professor Demi Latiji, so MNI, Deputy Vice Chancellor, Academics and Administration, university registrar, bursar, and university librarian, provost, LASUCOM, deputy provost, LASUCOM, deans of faculties and schools, directors of institutes and centers, heads of departments and academic units, esteemed professors of Lagos State University, members of staff of Lagos State University, students of Lagos State University, ladies and gentlemen of the press, distinguished guests, ladies and gentlemen. I welcome you all to this celebratory gown and gown event. Formally introduce my expertise as a professor of orthopedic surgery to the academic community and the public. I am indeed grateful to the Vice Chancellor, distinguished Professor Idiyemi Olatunji Bello, MNI, for giving me the opportunity to present this lecture. I consider this not merely a personal milestone, but also an opportunity to reflect on the growth of orthopedic surgery within our institution, our healthcare system, and our nation. This lecture is especially significant because it is only the first or the second inaugural lecture to be delivered by an orthopedic surgeon, and indeed the second from the Department of Surgery in Lagos State University. The first was given by Professor Oladipо 2 years ago. I sincerely hope that in the years ahead, many more of my mentees and younger colleagues will stand here to continue this academic tradition after the eventual establishment of a fully independent Department of Orthopedics within the Faculty of Clinical Sciences. Today, I intend to introduce my academic journey and highlight my contributions to orthopedic surgery, focusing on the limping gait as a theme. The title of this lecture, From Limping Steps to Confident Stride, Journey of an Academic Orthopedic Surgeon, reflects two interconnected journeys. The first is the journey of countless patients whose ability to walk, work, and live independently has been threatened by musculoskeletal disease, deformity, or injury. The second is my own journey through medicine, surgery, research, teaching, mentorship, and public service. Orthopedic surgery is fundamentally concerned with movement, the ability to stand upright, to work with dignity, to work productively, and to maintain independence among the greatest needs of human existence. When these abilities are impaired, the consequences extend beyond the physical body. Loss of mobility often results in pain, loss of dignity, social exclusion, emotional distress, and economic hardship. First, the orthopedic surgeon does not merely repair bones and joints. He or she restores confidence, independence, and hope. I consider myself very privileged, being a prince of Ondo Kingdom from the Lion ruling house. My great-grandfather, Arunai, was Prince Oshemari of Ondo in 1909. I was also born into a medical family. My father, Dr. Solanini ADEWOLE, was the first to graduate as a medical doctor in the colonial Ondo province in 1941, having trained at the University of Glasgow, Scotland. Furthermore, he was the sixth Nigerian to pass the fellowship of the Royal College of Surgeons and was the first Nigerian orthopedic surgeon. My mother, Mrs. Dolo Adewole, was an accomplished nurse, nursing administrator, and one of the pioneering figures in nursing leadership in West Africa. She trained at Bolton Royal Infirmary, England, qualified as a state-registered nurse and midwife in 1952. She returned to Nigeria in 1954 and started her career at the as a nursing sister at the University College Hospital, Ibadan, before she moved to Royal Orthopedic Hospital, Igobi. She rose to the post of Chief Nursing Officer of the Federation and Chairperson of the Nursing and Midwifery Council in 1975 and was the inaugural president of the West African College of Nursing in 1981. My grandfather, Dr. Oladi Omari, is a famous pediatrician on Lagos Island. I recall vividly the Nigerian Civil War, during which my father served in the Nigerian Army Medical Services. Helicopters landed at the orthopedic hospital in Igobi to transport him to care for lasting families. Those experiences left a lasting impression on my young mind. My education at King's College, Lagos, exposed me to academic discipline, leadership, sportsmanship, and broad intellectual development. I participated actively in sports and extracurricular activities while maintaining strong academic performance. I was also a member of the King's College Cadets Unit. At the University of Ife, I had the privilege of learning under exceptionally gifted surgeons and clinicians whose passion for excellence greatly influenced my professional aspirations. By the time I completed my housemanship, I knew I wanted to be a surgeon. My residency training in orthopedic surgery at the National Orthopedic Hospital in Igubi was very rewarding. I remain profoundly grateful to my trainers and mentors in the Navy who instilled in me the values of discipline, technical excellence, compassion, and dedication to duty. After residency training and passing the fellowship examinations, I went for further training in Israel in pediatric orthopedics and joint replacement surgery. After a stint as a local consultant at the Royal Hospital in Etimeta, I was appointed consultant in General Hospital Lagos, where I set up an orthopedic unit with late Victor Olaketu. I was transferred to LASUTH in December 2000 and went to consultant special grade level 17 before being appointed as the first orthopedic lecturer in LASUCOM in 2004. Madam Vice Chancellor, please pardon me for so extensively going through my journey up the ladder that brought me here today. These are the foundations of my journey. As modern surgeons, we have come a long way from our forebears, the travel surgeons, who practiced their trade in cabin salons, removing lumps and bumps with sharp knives. Some of the basic principles of surgery dates back to Hippocrates, who lived around 360 to 370 BC. The word orthopedics is derived from two Greek words, orthos meaning straight or correct, and pedia meaning education or child rearing. Nicolas André de Bois-Regard, who lived between 1658 and 1742, was a French physician and writer who played a significant role in the early history of both parasitology and orthopedics. The term orthopedics was taken from his book entitled Orthopedy, when he published his introduction to orthopedics in 1741. Another surgeon, André Varroa, is regarded as many as the father of orthopedics because of his development of the practical applications of the art of preventing and correcting deformity children. What is a gait? A gait simply a manner of walking or moving on feet. Words are not said. Madam Vice Chancellor, My focus today and for this lecture is the limping gait. I intend to discuss this from the point of view of my experience as an orthopedic surgeon and metaphorically to outline my journey to surgery and medical education. The limping gait is an abnormal walking pattern due to pain, weakness, deformity, or nerve dysfunction. In Yoruba culture, there's a profound saying, Atiro, Mesekule, Omoji, meaning the one who limps, to strengthen his legs as the journey is far. Pain encapsulates the essence of orthopedic surgery. Our responsibility as orthopedic surgeons is to strengthen those legs. Pain carries a symbolic significance across many cultures and religious traditions. In the Judeo-Christian tradition, Jacob limped after wrestling with the angel. In Greek mythology, Festus, the god of craftsmanship, was lame. In the Quran, the Prophet Muhammad repeatedly said his actions and intentions, not appearance or physical form, matter more to God. Traditional Yoruba philosophy, that's the Ifa pantheon, similarly recognizes both the vulnerability and the resilience associated with physical disability. It will not go unnoticed for good or for bad. Utiro needs help for acceptance in day-to-day life. First, throughout human history, painting has represented struggle, endurance, community, and transformation. In my not so short career as an orthopedic surgeon, I have tried to restore the dignity of Atiro. Walking is a highly coordinated program process involving balance, muscle power, joint movement, nerve control, and skeletal alignment. The gait cycle, as shown on the slide, the sequence of movements occurring, occurring between two successive strikes of the upper on the ground by the same foot. Has two major phases. Stance or weight bearing phase, where the foot is on the ground, constitutes 60%. And when one foot is in contact with the ground from the wheel strike to the floor, the other foot is in the air. When these mechanisms are disrupted, something occurs. The disruptions include pain, muscle weakness, or stiffness, and a shortened limb. Reasons for work in rhythm of walking range from a tight shoe to a tight person. But the common causes of limping include developmental or genetic conditions such as clubfoot, limb deformities, bone legs, knock knees, injuries, fractures, infections, inflammatory joint conditions such as arthritis, degenerative spine disease, and osteoporosis. Most of my career has been focused on understanding and treating these conditions. One of the major areas of my academic and clinical interest has been clubfoot. Clubfoot, also known as congenital talipes equinovarus, a deformity present at birth, the foot turned inward and downward. Without treatment, affected children open on the sides of their feet or the tops of their feet, and this results in pain, disability, social stigma, psychological trauma, and lifelong functional limitation. Clubfoot is the commonest birth abnormality of the limbs, as described by Hippocrates, the father of medicine in 400 BC. It is estimated to occur in about 1 in every 1,000 live births. It's commonly in males with a male-female ratio of 2 to 1. It affects both feet in 30 to 80% of the cases. The exact etiology of clubfoot is unknown, And many theories have been proposed because no single claim adequately explains this anomaly. But there's definitely a genetic predisposition. As you can see in the slide, the baby is more fortunate than the mother because he got treatment. My first academic publication on club foot reported 72 consecutive cases of club foot at Lasso. 38 of these cases had bilateral deformities totaling 100 feet. Our study revealed no sex preponderance and no association with advancing maternal age. The study, however, revealed some disturbing findings, such as community presentation, awareness, and widespread ignorance about the effectiveness of orthodox treatments. We therefore advocated public enlightenment, dedicated painful treatment clinics, and early referral pathways. This slide shows our modest team at the beginning. A major advancement in clinical treatment came through the adoption of the consulting method. This is a non-surgical technique which includes steroid manipulation, vaccine, and medical surgery to cut the kind of tendon indicated. After correction, prolonged bracing is required all the time for 3 months and then at night and nap time until age 4. This method avoids the extensive use of surgery in the overwhelming number of patients. Professor Ponseti was a Spanish American orthopedic surgeon who lived to us in 1941. He developed this method, which did not gain widespread acceptance until 50 years later in the 1990s and 2000s, quickly due to the advocacy of his patients' parents over the internet. This method was formally introduced in Nigeria in 2009 when Dr. Bonseti's protagonist, Dr. Mapanda and Shafiq Burhani, came to Ileife to conduct the first Bonseti treatment training program. I was one of the lucky participants at this training, and later I attended workshops at the University of Iowa, where Dr. Ponseti worked, and Barcelona. Unfortunately, I didn't meet Dr. Ponseti before his demise. The slide shows Dr. Ponseti, the manufacturing, craft, and the grace. We published our early experience with Ponseti clinical management on 106 patients, 58 feet in Lasso, and our results were comparable with most series worldwide in terms of duration of treatment and number of casts to correction. It was observed that the relapse rate within 1 year was low. It despite the low termination rate at 26%. The birth compliance was a challenge. This slide shows a newborn baby with club feet who was treated in our clinic and her feet corrected after 5 weekly treatments only. One of the prescribed treatments of the Ponseti method involves cutting the heel cord, that's the Achilles tendon near its insertion. This is demonstrated on this slide. Fortunately, the heel cord heals fully children under age 5 after it's cut. We published our experience with Ponseti protocol and Achilles tenotomy in management of clubfoot, study of 124 patients, 209 feet, highlighted the low tenotomy rate of 23%, which was much lower than the 70 to 90% reported in most studies worldwide. But our initial outcomes were good. We concluded that clubfoot can be managed with reduced frequency of Achilles tenotomy. The duration of follow-up observation in this study was very much short. And I must admit at this point that I am now wiser. From public data from the Lancet Global Clinic Robots that will now perform Achilles tenotomy up to 75% of our patients because we noticed a higher recurrence rate after longer follow-up. Although our initial outcomes at LASO compared favorably with international standards, this compliance presented a major challenge because many families supposedly could not afford the required vaccine. In response, we partnered with Rotary clubs of Victoria Island, Victoria, and Bagada with the help of practicing governors Dr. Matthias Sugar and Dr. Kamoru Ramotosho, both of them orthopedic surgeons. The collaboration with Rotary enabled us to provide free treatment and subsidized pricing. When another organization, Miracle Feet, an international non-profit organization that provides treatment for cancer worldwide, came on board, Platelet care became completely free for all children aged under 5, and hundreds of children have benefited from these interventions. On this slide is a quick picture taken after one of our clinics. Outcome of the Rotary intervention of 137 children was published, and the intervention was associated, as expected, with an increase in attendance at the Crawford Clinic. But the relapse rates remained the same, presumably because the patients were not completely free. This publication encouraged our colleagues in other parts of the country to follow this path. Today, the United Crawford Clinic is supported by Miracle Fee, and as I said, many children are treated free. For me, few experiences in medicine are more gratifying than witnessing a child who would otherwise have grown up disabled return to life normally. In many low resource environments, children frequently present late after already starting to walk. Traditionally, such neglected cases require extensive surgery, but our multi-center Nigerian study of 225 patients demonstrated that even neglected cancers can be corrected successfully using this Persetti method. 78% of the feet achieved correction without major surgery. This reinforced the importance of adapting global best practices to local reality. In other club foot research, we saw 48 parents studied how the Persetti method affected the developmental milestones of their children. We found that only upright ambulation, that's walking, was delayed by up to 2 months. We also reported the relationship between club foot and umbilical hernias. Out of a total of 110 patients, 22% had umbilical hernias. Study suggested that the association may not be causal, but larger epidemiological and genetic studies. We also measured the Achilles tendons of 22 children with unilateral clockwise, using ultrasound, and compared them with the lunar side, showing that the Achilles tendon of the clockwise is consistently longer, narrower, and fuller than in the normal foot. Another important aspect of my work involved limb deformity correction. At one stage, large numbers of children with severe deformities were seen begging on the streets of Lagos. And this reality prompted the Lagos State Limb Deformity Correction Program. Through this initiative, we published a study of 1,321 patients who were screened and identified who underwent surgery for either bone legs, back knee, recasts, or paralytic deformity. Only 20% of these children were aged 10 years and below. There were more females, and women were the commonest deformities seen. 8 presentations for orthodox treatment were observed, and it demonstrated that these patients did not need to stay in hospital for more than 24 hours after surgery. One important lesson from this program was that many deformities are highly treatable when identified early. Public awareness and early referral, therefore, remain essential. Pictures on the slide show some of our success stories. One of the more technically demanding area of orthopedics involve bone reopening and reconstruction. Using the Elizabeth principle and distraction osteogenesis, things can be gradually lengthened through controlled mechanical traction. The bone is surgically cut and the ends are gradually pulled apart using an external device, the rate of 1 millimeter per day. We have successfully used these methods to treat short limbs, complicated fractures, defects, and for limb reconstruction. We reported the first case on this subject in West African literature as far back as 1997. A 9-year-old female with 8 centimeters of short limb, 6.5 centimeters of length regained using this method. We later reported 40 cases of complicated fractures managed by limb welding with excellent outcome in 27%, good outcome in 63%. The images on the slide show limb correction using an X-ray device, Fuller special foam. We also studied rickets. Rickets is a metabolic bone disease characterized by poor mineralization of bone and a cause of limb deformity. We studied the physical and biochemical characteristics of 44 children with angular knee deformities divided into 2 groups, one with radiographic evidence of rickets and the other without. In the rickets group, bilateral valgus deformity, that's legs, was most frequently seen. Calcium levels were found to be low in the rickets group, but normal in the non-rickets group. But vitamin D distribution was the same in both groups. Contrary to common assumptions, our findings suggested that calcium, rather than vitamin D deficiency, plays a significant role in rickets among Nigerian children. The outcome of this study has important implications for nutrition, child health, and public policy. Images on the slide show children with severe deformities as a result of untreated rickets. We also studied spinal disorders. Spinal disorders constitute another major cause of disability and abnormal gait. Our publications documented the progressive advancement of spine surgery in Nigeria. Our article titled Surgical Disorders of the Spine in Adults, Ecology and Outcome was inspired by steady and progressive advancement in spine surgery in Nigeria, with the increase in the number of spine surgeons, as well as the availability of MRI, intraoperative fluoroscopy, that's X-rays, and titanium implants. We reported 27 adults aged 18 years and above had spine surgery and observed that degenerative spine disease and spine trauma were the 2 most common indications for surgery. And good outcomes were mainly related to the degree of pre-operative neurological deficit. With the increasing number of spinal implant surgeries performed in LASSO, we published a paper on posterior spinal decompression stabilization and arthrodesis. 26 patients aged 28 to 78 who had spine surgery with metal implant stabilization had good outcomes. These images show examples of spinal implants. Most of us in this hall will recall that not too long ago, medical tourism became very fashionable in Nigeria, the patients leaving our country to access non-emergent medical and surgical care abroad. Favorable foreign exchange rates at the time gave them a competitive advantage. We studied 23 patients who visited our center after having surgery abroad. The group 14 had spine surgery. The most visited country was India. 2 patients had surgery performed at the wrong level, and the most common complication was infection. Study recommended regulation of medical tourism. Another major area of my research has been osteoporosis. In this condition, the bones are thinner and less dense and therefore prone to fractures. It's commoner after menopause and the climacteric, that's the male version, and will be induced in long-term steroid therapy. Examples are inhalers, tablets, and even bleaching creams. For many years, osteoporosis was incorrectly perceived as uncommon among Black African populations, and studies demonstrated clearly that osteoporosis exists in Nigerian populations and increases with advancing age. Osteoporosis is diagnosed by measuring bone density and remains an important area for future research as life expectancy continues to increase in our environment. On the slide is an image showing the progressive spine deformity that occurs as a result of osteoporosis. In our study on bone density measurements in Black women, the bone density of a cohort of young, healthy women, Nigerian Black women, aged between 23 and 30, and a non-biased sample of 70 Black African women aged between 50 and 78 were measured. The data was compared with the published age-matched normative data for African American women. The bone mineral density in a young, healthy female Nigerian was found to be higher than the age-matched African American young, healthy female, meaning ladies have stronger bones. This was the first publication on assessment of osteoporosis using the gold standard dual X-ray absorptiometry or DEXA in the West African sub-region. On this image, slide, on this slide is the image of the machine that we use. One of the treatments for prostate cancer, androgen deprivation therapy. We measured BMD, the ADT, where we measured the OMD of 124 Nigerian men between 54 and 88. This group of 77 for an androgen deprivation therapy for advanced prostate cancer. We found that another 77 had benign prostate. We found that advanced prostate cancer was associated with a decrease in bone density, and that this ADT treatment was associated with a further decline in bone density. In another publication, we examined the frequency of osteoporosis in Black African women aged 50 and above, degenerative musculoskeletal disease and fractures. We enrolled 173 subjects and found the frequency of osteoporosis in which there was more among patients with degenerative spine diseases than those with fractures. We recommended routine screening for women 50 and above for osteoporosis. There's no doubt that Nigeria currently faces a major trauma window. Our 6-year audit between 2001 and 2006 of emergency ambulance services in Lagos revealed that trauma accounted for nearly 90% of emergency evacuations and with 32,664 cases reported, with a meaningful ratio of 2 to 1. We observed certain operational challenges, and these will come as no surprise. Up on the list was traffic congestion, good response times, inadequate trauma systems, and public cooperation. People just refuse to move out of the way for the ambulances. A follow-up study is going due, and I urge my successors to please take up this challenge. Arthritis is another cause of limping. Arthritis is a cause, is particularly, is common, particularly in the elderly. It is due to cartilage wear and manifests as pain, swelling, and stiffness. Types of arthritis include osteoarthritis, inflammatory arthritis, and gout. Late stage, these conditions usually require surgery, that's joint replacement. In the early days, joint replacement implant companies did not have all the implant sizes available. Concluded in multi-center study on the commonly conducted a multi-center study on common sizes of implants used for knee replacement surgery in Lagos, and recommended common sizes to be stopped. Thankfully, joint replacement surgery has expanded considerably within Nigeria over the past 2 decades. We now have full complement of implant sizes available for use. Hundreds of hip and knee replacements have been successfully performed in lawsuits. From this progress reflects the growing capacity and sophistication of orthopedic surgery in Nigeria. What are our future directions? The future of orthopedic surgery in Nigeria depends on research, innovation, collaboration, training, and sustained institutional support. For the several areas that require investigation, I would recommend the following. One, that we investigate the true origin of osteoporosis in our environments, investigate the long-term outcomes of these treatments. We look into artificial intelligence driven deformity correction for planning and improving trauma management systems. We should also look at fair prevention studies along the elderly. Because I'm starting to see more and more elderly patients present after a fall. My recommendations are as follows. One, establishment of a tiered trauma system for Lagos State by designating trauma centers from level 1 to level 4. Now, level 1 is the highest and level 4 is the lowest. With a formalized referral pathway and inter-hospital transfer protocol. Also, will be designated as the level 1 center in Lagos State. And there should be one level 2 trauma center in each senatorial district, one level 3 in each local government area, and one level 4 in each local council development area. I also recommend the establishment of the Lagos State System Authority to administer this trauma system. The new deformity correction program should also be revamped to become a routine in secondary institutions instead of us carrying out surgical camps. The school health program should include removal of one with high calcium content, such as dairy, butter grass, and soft boiled fish. There should be continuous monitoring of children in schools to identify those with low deformity and move to secondary healthcare institutions. Insurance coverage for pharmacy surgery correction under the Lagos State Health Insurance Program INAUGURAL is recommended. Finally, I recommend institutionalized and formal subspecialty orthopedic training in Basel. In conclusion, Madam Vice Chancellor, ladies and gentlemen, from time immemorial, the limping gait and its complications have been well documented. Examples abound in teachings of Judaism, Christianity, Islam, ancient Greek philosophy, and traditional Yoruba religion, before pantheon. To restore mobility is to restore dignity. Orthopedic surgery transforms lives. This lecture is a summary of my efforts to prevent, diagnose, and treat conditions that cause people to walk with a limping gait and therefore restore their dignity. This is also the story of my personal academic journey from limping steps to confident strides. I sincerely hope I've contributed positively to active acceptance day-to-day life. Madam Vice Chancellor, one of the greatest privileges of academic life is the opportunity to train future generations. I have contributed to undergraduate and postgraduate education, practically supervision of dissertations, textbook contributions, examinations, and postgraduate training programs. Several residents trained under our programs have since become consultants and leaders in the healthcare system. Currently, I serve as chairman of the Faculty of Orthopedics of the West African College of Surgeons, member of Court of Examiners, and a member of the council. One initiative particularly dear to me has been the promotion of female participation in orthopedic surgery. I am especially delighted that one of our senior female residents, Dr. ADEWOLE recently won a bursary award of $5,000 to support her research. ADEWOLE, I love her. My contributions to LASU and LASUCOM include my statutory memberships to the Senate, Academic Board, and Faculty Board. I've also already told you that I'm the head of the orthopedic unit in LASUCOM. I was vice chairman, not vice chancellor, vice chairman, Faculty Day Committee, Faculty of Clinical Sciences between 2014 and 2016, and I coordinated intermediate clinical postings and objective structured clinical examinations in Department of Surgery. I am currently a member of the Court of Governors and chairman of survey. In lawsuit, I was instrumental to the creation of the Department of Orthopedics from the Department of Surgery. And as pioneer HOD, you're able to secure appreciation and training of residents. I'm also a member of several committees, including the Management Committee, Medical Advisory Committee, and Disaster Management Committee. I am particularly proud to have been involved in the Lagos State Limb Deformity Correction Program since inception. I must acknowledge the efforts of Drs. Dolapo Fashawe and Tolu Ajomale of the Lagos State Ministry of Health. Several surgical camps were conducted to correct these deformities. The pictures on this slide show the screening venue, one of the screening venues, examples of deformities, and my team at work. And the last one is us celebrating the award of excellence we received from Governor Babatunde Raji Fashola. My national contributions include membership of the Ministerial Committee on Emergency Preparedness and is a volunteer at the Africa Cup of Nations Nigeria 2000 FIFA Youth World Championship, Championship in Nigeria 99. My professional contributions include those to my association, Nigerian Orthopedic Association, where I was chairman, chairman local organizing committee for the meeting in Lagos, chairman specialties committee of the Nigerian Medical Association, and believe it or not, he was the Secretary General of the Great National Association of Resident Doctors. Madam Vice Chancellor, I cannot thank you enough for giving me this opportunity to share my journey with August audience. I am indeed grateful. I also want to thank the entire management committee, particularly the Deputy Vice Chancellor, academics, and his team for the role they played in the success of this event. I must acknowledge my mentor, and I will start with my teachers at IFE. With Professor Akinbankole as Dean of Faculty of Health Sciences, which I had me, with Dr. E. Bangui, which was the rudiments of orthopedic, and others. My fellows at Igobi, Dr. Efe Nishino, who am PhD at Igobi, Dr. Jeremiah or Jerry Grange, my pediatric orthopedic mentor, who introduced me to Cloudfoot, Dr. Bill Onobowale, an astute clinician and administrator, Dr. B.I.C. Anybody, skilled traumatologist, Dr. Olayemi Popola, my boss, my friend, and my big brother, and Dr. Olayemi Adewole, with whom I published my first paper. My research mentors are Professor Emi Bankole, who introduced me to the evidence of research when he came back from Saudi in Basel. Professor Osenkiwa, my big brother, girlfriend, partner, and friend, who encouraged me to push myself to improve the quality of my publications. Professor Odu Ekweore, you may have forgotten this, but you introduced me to reference management software. It was like magic. Thank you very much. My other mentors include Professor Adetokunbo, Baba, I haven't seen him here today, my friend and big brother. He urged me not to give up when I was worried. My co-researchers, several of them, Professor Giwa, Professor Ufemi, Professor Idorufade, P. Michael, Hardy, and others. My colleagues, this slide shows them all. This is the really busy slide of this presentation. I acknowledge the roles each and every one of them played in my journey. All of us staff, including all of our staff, who made my work much easier. All of you are acknowledged. But I must give special thanks to Professor Sogiwa and Professor Chris Body for reviewing this lecture, and Dr. Adewola and her team for working tirelessly to ensure the success of this event. Lastly, my dear friend and colleague from our days as residents at Igobi, Faith Dr. Adebola Baketu, and his soul rest in peace. My friends and patients, I've seen several of them, my numerous patients who trusted my clinical and operative skills. I can see King's College boys. I can see gentlemen of the Tea Party and Eba Table, and I can see some gentlemen of the Metropolitan Club. I will thank you for coming. I must acknowledge my own heritage. His Imperial Majesty Ọba Dr. Victor Adesinbo Adenofo Kilade John, Kilo III, the former of Ondo, is ably represented here by Dr. Dr. Oluseyi Robertson, the military member of Ondo Kingdom. Dr. Roberts is wearing two caps because he's also my cousin, professional friend, and brother. I thank you. I also acknowledge the presence of the Adewole and Roberts family descendants. By Lagos heritage, I can see them there. The Libu of Johnson descendants, I can see Asuke there. Thank you so much for giving me all the support you found over the year. My parents in law, Chief Dr. Olusegun Oshikere, FCA, OUN, OFR, the Babalaji of Ijebuland. Oh, sorry, Babala. Special acknowledgements and Chief Mrs. Olusegun Oshikere for giving me a true life and feeling the void left by my biological parents since their demise. May the Almighty strengthen your legs as you continue to age with grace. My siblings, Sanchez is gone now. I couldn't make it, but what they are doing is here. Prof. Tokumbo. Adeyemi is abroad. Mushibolato, I can see you. Thank you very much for your support over the years. My children, Obafulayo and Lukman, Fasasi, Keji Adeyemi, and my dear grandson, Olufikayo Fasasi, who is having his afternoon nap right now. Last, but definitely not the least, my jewel is in Valley. My companion, my lover and best friend, Olufalakan, Fasalafin Adeyemi, a virtuous woman, a woman of noble character, strength, and wisdom. Valued far above rules. He is industrious and resourceful. Brilliant and kind, strong and courageous, generous and God-fearing. I could not have asked for more. He has been my pillar of support over the years, giving me a peaceful home and looking after my children and I, despite my extremely busy schedule as a banker. He believed in me and pushing me to do research and publish articles. It stop until I finish writing this lecture. Continue to bless him abundantly, and in later years, the better than follow. Madam Vice Chancellor, ladies and gentlemen, independent human locomotion, being lost, has devastating effects. When the ability to work properly is restored, independence, dignity, and hope are restored. Yet that independence never deserts us all in our old age. Amen. Actually, lẹ́sẹ̀ kó lè ọ̀nà jìn. The one who lives with nothing is nice, is the journey is far. Thank you.
That was Professor OLADIPO ADEWOLE, and in his inaugural lecture titled From Limited Steps to Confident Strides, the journey of an academic orthopedic surgeon, asserts that musculoskeletal health is essential to human well-being, and that preventing, treating, and rehabilitating orthopedic surgery conditions are critical to enabling individuals to lead active and productive lives. Drawing on the distinguished career in orthopedic surgery, he calls for greater public awareness, stronger institutional support, and sustained investment in orthopedic care to help Nigerians move from disability to confident mobility and improved quality of life. Professor Adewole, congratulations, and I welcome you to the body of professors in the Lagos State University, the University of First Choice. Congrats.
Ladies and gentlemen, can we please remain standing as the academic procession takes leave in reverse order? Àti mẹ́sẹ̀ tó lé ọ̀nà dín. Finally, there is light at the end of the tunnel for Atiro. That has been his 125th inaugural lecture of Lagos State University. Delivers Professor Oladipo Adewole, titled From Limited Steps to Confident Strides, the journey of Ladies and gentlemen, this is Lagos State University, Nigeria's best university, Nigeria's best university, and it's been a pleasure having you join us for the 125th inaugural lecture of our great university. Once again, thank you very much for coming. God bless you. We are last yeah, the greatest. We are last the pride of Latin. Thank you. Have a great stay going back to the information. God bless you.